the heart of rural Kenya, an invisible threat lurks in the tall grass and on dusty paths. It's a silent epidemic, claiming over 100,000 lives globally each year, yet it is often ignored. A single bite can turn a life upside down, leaving families devastated and communities in fear.
Kuna jirani yangu tu hapa ni kwangu hapa juu. Sasa jirani yangu next alikuwa ameumwa na nyoka lakini hayuko sahi.
Nikasikia tu kitu imeniuma na mwili yote ikakuwa vibaya.
Kata nyasi kule chini nilisikia kitu kama imeniuma kwa mguu. But sikustuka, nikaendelea kukata. Baadaye nikahisi kama nasikia uchungu. Hiyo wakati ilining'ata, nilihisi uchungu kwenye akili na kwenye mguu hapa.
Ilikuwa tu jioni wakati wa saa 1 hivi. Nilikuwa nahakisha taa ya keroboi niliweka kwa meza. Alafu vile nilipita nikasikia tu kitu ikauma mguu.
But what if the change was possible? What if a group of dedicated people could turn the tide? Our journey began with a simple question. How can we make a difference in the communities for a disease that still remains neglected?
My name is Dorothy Okemo and I'm the Kenya Snakebite Project Coordinator, a project that has been funded by Health Action International since 2019. And you'll realize the project actually started in 2019 after the WHO resolution that declared snake bites neglected tropical diseases. A year before that is in 2018. And so in Kenya, because there had been very little work that had been done around snake bites, our first point of entry was to try and establish the burden of snake bites in Kenya. And so the very first thing that we did is to undertake different types of research in snakebite endemic counties. Number one, to establish the burden of snake bites in those counties. Secondly, to establish the knowledge and capacity gaps among healthcare workers to see what kind of knowledge they had around caring, managing, and treating of snake bites. The third one was to establish the socio-economic consequences of snake bites among the affected family members and the snakebite survivors. Of course, the fourth one was also to really look inwards at the community themselves and look at the beliefs, the myths and misconceptions that were likely to affect the care and management of snake bites. So armed with this research, which we did in a number of counties, we had a good idea of what the starting point should be in terms of rolling out this snakebite project.
The project didn't just bring medicines through advocacy, it brought knowledge.
When we are walking, remember you are supposed to wear closed shoes. Do you have closed shoes in our place? Yeah. Also here in our school, most of learners have closed shoes.
We went directly to the people, working with community health promoters and even school children to change generations of beliefs about snakebite management.
Mimi naitwa Ezibejahenda. Hiyo mafunzo mpya tulipata ya kwamba kama ameuma unamleta karibu atulie. Kama huyu alitoka huko chini alikuwa amefunga mkono kabisa vile alikuja nikamwambia toa hii. Akatoa, nikamwambia basi relax. Akarelax tu akakaa hapo. Kama tungali tunatafuta pikipiki ya kumpeleka hospitali. Nilijua ya kwamba nimefunzwa mtu atulie, tusioshe pale, asifunge. Kama hiyo nyoka ingekuwa karibu tungejua ni nyoka gani, lakini kwa sababu ilikuwa chini na yeye akatoroka huko akakuja. Sasa mimi nilikuwa namuuliza hata ilikuwa inafananaje. Akaniambia ilikuwa ya black. Na ikaniuma na mimi nikatoroka nikakuja. Nikafanya referral, nikampea karatasi, nikatafuta mtu wa pikipiki, nikamweka kwa juu, akampeleka Vihiga. Hiyo ndio iko karibu na sisi. Vile alifika huko na wao tena wakamwambia aende referral Mbale. Kuna jirani yangu tu hapa ni kwangu hapa juu. Sasa jirani yangu next alikuwa ameumwako na nyoka, lakini hayuko sahi. Kabla sijajua mafunzo, siku hizo tulikuwa, yani ukipata kama ameumwa tayari, sisi tulikuwa nakata hapo na kawembe, alafu nilikuwa na dawa ya permanganate naweka hapo, alafu inazuia damu hata kutoka, alafu inawacha na kila kitu. Hiyo ndo tulikuwa nafanya.
Wakati mimi niliumwa na nyoka, nilikuwa nafanya shughuli zangu za nyumbani. Nilikuwa nang'oa nyazi ya ng'ombe. So katika ile harakati ya kung'oa, unaweka hapo, unang'oa, unaweka hapo. Sikujua nyuma mahali nimetoka, kumbe nyoka imenyemelea, imejificha kwa hiyo nyazi. So wakati nilikuwa napeleka mkono hivi, niibebe nipeleke nyumbani, iliweza kuniuma hapa. So nikasikia tu kitu imeniuma na mwili yote, mpaka yani mwili yote ikakuwa vibaya. Nilirusha hiyo nyazi chini, nikashindwa ni nini imeniuma. Ndio nikapata kumbe ni nyoka, ilikuwa ya black na ilikuwa inafanya hivi kwa nyazi. Nikaona mkia yake ya nyuma black na ilikuwa mrefu. Nilipiga nduru, nikashika mkono hivi na nikatoka mbio. Nikaitana binti yangu alikuwa nyumbani, nitafutie kiraka, akanifunga hivi na nikatoka saa hiyo hata sikunawa. Nilienda tu vile nilikuwa na nikaenda kwa hospitali Mbale.
Rambirambi zangu kukata nyasi kule chini, nilisikia kitu kama imeniuma kwa mguu, but sikustuka, nikaendelea kukata. Baadaye nikahisi kama nasikia uchungu. Hiyo wakati ilining'ata, nilihisi uchungu kwenye akili na kwenye mguu hapa. Baadaye nikaendelea kukata nyasi, uchungu ikakuwa si ya kawaida. Nikampigia baba, nikamwambia nimeumwa na kitu kule kwenye shamba kule chini na sijui ni nini. Sasa akaita msaidizi wake wa karibu, ndiye akakuja. Sasa ule venye aliona akasema ni nyoka. Sasa venye alisema ni nyoka, ndio hapo sasa damu yangu sasa ikastuka. Ndio sasa mguu ikakuwa nzito kuliko venye ilikuwa. Yaani kama umevaa buti yenye matope. Na sehemu yenye ilining'ata imekuwa nyeusi. Ndio tukakimbia haraka kwa hospitali, nikatibiwa.
Ilikuwa tu jioni wakati wa saa 1 hivi. Nilikuwa nahakisha taa ya keroboi niliweka kwa meza. Alafu vile nilipita, nikasikia tu kitu ikauma mguu. Vile nilichukua taa nikaangalia, nikapata ni nyoka. Sasa hiyo nyoka nikaua, nikafunga mguu. Sasa ndio nikaita watu wakuja wakanichanja, wakachanja, alafu wakanipeleka hospitali. Nilikuwa sijatengeneza vizuri kwa nyumba. Sasa vile nyoka iliniuma, ndio nikapoma vizuri. Sasa tangu siku hiyo nyoka haijawahi kuingia tena.
Narula mundu nilichembesa mula mukunda. Namusala kweliho. Nimandika bungeshi. Nalo namenye na Holandi lichembende. Nimandika nako. Ninzoka irula muni isiaka kushirenge. Nindilo malibiri. Inirata. Inje mbora mwali kwa wanje. Inzoka inumi. Lichembe luwachi mwanjanja kushirenge.
As we continued to do the behavior change communication and the community sensitization, we realized that the community members had very deeply entrenched beliefs around how to manage snake bites. And so in our wisdom, we decided to incorporate the school health program as part of the snakebite interventions.
The school health program is a key component of HAI snakebite strategy to enhance knowledge and practice of snakebite prevention, first aid and mitigation among learners. We effectively launched this initiative in 2022 with a pilot program in Kajiado County in 2 primary schools and 1 high school, where we also validated our innovative comic book, Safia's 8 Secrets. Safia's 8 Secrets is a comic book highlighting the 8 secrets on snakebite prevention specifically designed for school children aged 7 to 15 years. We have disseminated this comic book across 20 schools, reaching over 2,000 learners from Kisumu, Kakamega, Kajiado, and Vihiga counties. We have also reached over 150 teachers. The feedback and comments received during the validation process were carefully considered and incorporated into the final version of the comic book. We also developed a board game modeled on snakes and ladders, board games that has also been disseminated in the schools and incorporate as part of the school health clubs. The impact of the school program is evident and evidence-based. The assessment of retention of knowledge gained through this approaches showed a 98% retention level, a testament of the real impact of utilizing innovative approaches for behavior change communication.
And so what we did to this end is to also develop very innovative IEC materials targeting these school children. And so we developed a comic book that is both available in English and in Swahili. That is Safia's 8 Secrets, or Siri Nane za Safia. And we are happy to say that this comic book has also been translated into French and disseminated in countries like Rwanda. We also went further and developed a board game that is heavily borrowed from the Snakes and Ladders board game, so that we can use this as a teaching aid in terms of teaching the students on how what they can do in the household level to prevent snake bite incidences.
Kuna game inaitwa Snakes and Ladders. Nani ameshawahi kuisikia? Umeshawahi kuisikia? Hebu explainie hiyo ni nini? Ehe. Ehe. Ndio hiyo.
Those games, in fact, has motivated the learners because they come to pick them by themselves, and they use those games to enlighten themselves. And it has even motivated them to practice it just intrinsically.
So, start iko wapi? Start ndio hiyo. Wapi hiyo dice? Angalia ndani hiyo bag. Kuna dice. Unafanya hivi. Ukianguka kwa 6, una move 1, 2, 3, 4, 5, 6.
Carry a flashlight while walking in the dark to see snakes crossing your path.
Hiyo sasa ni warning umepewa, so it's okay, now you know. When you're out in the dark, you carry a flashlight to see a snake crossing your path. Sindio?
This project provided us with a unique opportunity to adopt a multi-sectoral approach by collaborating with both the Ministry of Health and the Ministry of Education. Working closely with these government bodies allowed us to successfully roll out the Snakebite School program and ensure its integration into the school health program. International Snakebite Awareness Day serves as a platform for stakeholders, policymakers, communities, and organizations like the World Health Organization, WHO, to draw attention to the burden of snake bites globally.
Secret number 2. Use a torch outside at night. Keep food, water outside your house. Save firewood from your house. Secret number 5. Use a mosquito net to avoid snake bite during sleep. Secret number 6. Close holes in your house to prevent snake into your house. Good. Secret number 7. Cut grass. Secret number 8. Find how to get to the nearest health facility.
Mbele yenu ni wanafunzi wa shule Troban. Tuko tayari kuwakariria shairi lenye mada tuzuie kuumwa na nyoka. Hodi hodi inaingia, naomba mnisikize. Keti kitako mtulie na habari muhimu. Nyoka nyoka nyoka, nyoka kaumbwa na Mungu. Ni Maulana kumba nyoka jamani, sote tukubali. Nyoka kiumbe hatari, usimchokoze mwenzangu. Ni muhimu sisi sote tujihadhari na nyoka. Vabia tukiwa kichakani ama kiwanjani mwenzangu. Ni Maulana kaumba nyoka jamani, sote tukubali.
Unapotembea kichakani, beba kijiti mwenzangu. Gotogota ardhini, nyoka isimtetemeke. Anapohisi atatoroka, aepukane na wewe. Ni Maulana kumba nyoka jamani, sote tukubali.
Tufyeke nyasi na vichaka karibu na nyumba zetu. Nyoka watahepa mbio mbio, waende kula kwingine, tutabaki salama bila wasiwasi wowote. Ni Maulana kaumba nyoka jamani, sote tukubali.
Ziba mashimo kote kote, tuwazuie hata panya. Panya ni kitoweo kwa manyoka kweli kweli. Tukuwazuia panya basi, tuwazuia pia nyoka. Ni Maulana kaumba nyoka jamani, sote tukubali.
Tamati tumefika, na washukuru wenzangu. Tuondokea wengine, lakini ujumbe mnao. Tuzingatie haya yote, tuishi kweli kwa amani. Ni Maulana kaumba nyoka jamani, sote tukubali.
Nimefurahia sana kwa ajili ya hii program ya mafundisho kuhusiana na nyoka, ikizingatiwa ya kwamba hii shule yetu iko karibu na msitu na maji na miwa iko kando kando. Sasa tumeletewa hii program siku ya leo, hata sisi kama walimu tumefurahia sana. Mimi mwenyewe nafunza hapa watoto wadogo sana. Hii program imenifundisha hata pamoja na watoto wangu jinsi tunaweza ishi na nyoka bila kupatana na ile madhara ya nyoka. Tumejifunza ya kwamba nyoka ikikuuma, kwanza kitu ya kwanza sisi tulikuwa tunachukua kamba, tunajua tufunge, lakini tumejifunza ya kwamba ukiumwa na nyoka usifunge kamba, kwa sababu tunajua ya kwamba ukifunga kamba inaweza sababisha madhara ambayo inaweza kuletea kidonda baadaye. Ambapo tukajifunza ya kwamba inafaa tufyeke nyasi ndefu zile zenye zina attract nyoka kufika katika sehemu zetu ambazo tunaishi. Ambapo tumejifunza ya kwamba mtu akiuma na nyoka tulikuwa tunazoea kutumia kienyeji ama tunakuja na wembe tunakata, lakini nimejifunza ya kwamba kumbe ukiuma na nyoka unafaa upeleke mgonjwa wapi? Hospitalini. Tumefurahia sana katika hiyo mafunzo. Watoto wetu tunajua ya kwamba wakirudi nyumbani wamesoma na wataelimisha jamii kuhusiana na hiyo mambo.
But knowledge is only half the battle. We had to ensure the healthcare system was ready to respond. This meant equipping clinical officers, public health officers, nurses and doctors with the right training to effectively care, manage, and treat snake bites, including effective use and reliable supply of antivenom. By engaging with schools, children, and healthcare workers, we are confident that this initiative has significantly raising awareness about snakebite prevention among school children. This has also led to an abandonment of some of the harmful cultural practices that were used before. Increased reporting of snakebite cases and enhanced health-seeking behavior among community members.
In Shiru area, that is Shiru ward, so we've had many cases of snake bites in the area, especially when people go to fetch firewood from the forest, also around the farms. For those who come to the facility, that is the Shiru Health Center, we've had 2 cases this year from January to date, but majority prefer going to Mbale or Kapsabet due to lack of antivenom in our facility. As you get like during the time from time of being bitten by a snake till the time they reach the facility, then they're referred, so they go to other facilities. But from the community, they've notified like 8 cases of snake bites in the community. Even we had 1 death recently due to a snake bite. The client was en route to Kapsabet for referral. So the cases we get here, mostly from the presentation and the snakes they carry, like mostly it's not a venomous snake, as the community is already sensitized that when you are bitten by a snake, especially the poisonous, you go to Kapsabet Referral Hospital or Mbale. So in our facility, the ones I've seen was not poisonous from the clinical presentation. But for those who've gone to Mbale, we were able to do a follow-up story. The client received antivenom and she's doing well at home. Being in a health center, the community health providers have come in handy They've done sensitization, they've sensitized the community, especially those living along the forest area. When there's a snake bite, they refer promptly to our place. They have the referral forms where they fill the referral forms and send to us. Then from us, we are able to follow back to the community if they are able to identify the snake. And also after the client has been treated, they are able to give us feedback back to the facility, how the client is progressing. So feedback mostly we get from them, and also the referrals they bring to us. So far they come in handy, as most patients don't know where to go after the snake bite, but they're able to direct them where they can get the appropriate service. So it is a good linkage between the community and us using the community health providers.
There was a lot of knowledge gap in terms of snake bite. Most of the information that my colleagues had, mostly the nurses, in general, all the healthcare workers, it was just the information that it was gotten from the training schools. But after we had gone through the training supported by High Project, actually there was so much that the gap was really narrowed in terms of information, in terms of management. So what I can say, the project has really impacted positively to our staffs in terms of how to handle snake bites management, referral, and how to go about the whole scenario around the snake bite. First of all, our patients are coming from the community. Our patients are coming from the community where it is so much immersed in a lot of misconception about snake bites. And again, these are very poor patients. The first thing they'll bring the patient, when they bring the patient in the facility, you will hear from the relative or from the patient, this snake was sent. So if it has been sent, in quotes, they have done a lot of cuttings along, and they have just put some funny drugs around the thought entry of the venom, so that they just dry it up or pull it out. You see, so they are very open and they tell you exactly what they have done. So those myths, for them, they just come to the facility as a formality, but according to them, the issues of snake bites were supposed to be taken care of in the community. And again, like for the swelling, if the swelling mostly is it's gradually increasing, is when you will see the patient being brought in the facility, just to lower down the symptoms. But information is power. Information is power in a way that we talk to these patients, we give them the information, we dispel the myths. After we dispel the myths, we hear, oh, so we were not supposed to do this. And again, the beauty of it all, we've been talking to these patients when they come, and the information goes back home.
The approach that the High Project is using is a very, very good approach. Most of the time, health workers and myself, the challenge we have been having is that we are not able to identify the snake because we are not trained in wildlife, so we may not be able to identify the snake, and now we may be wondering, what do we do? But I want to appreciate what High Snakebite Project did, because they came up with an approach called syndromic management. And especially for the healthcare workers, that approach is very, very useful for us. Because when you are looking at syndromic management, you don't necessarily have to know the snake and all the details about the snake. But the most important thing is how the client presents. And that has helped us a lot to be able to be more confident in terms of assessing a client who has come with a snake bite. As a health worker myself and my colleagues that we have had the trainings, it has helped us to be very confident.
The snakebite envenomation, I learned the 3 syndromes. I just knew the symptoms, but I never knew there were syndromes. And after learning the syndromes, I've been using the knowledge to teach students who are coming here for attachment. This facility being a rural health training center, I've been using that knowledge to teach students on snake bites and envenomation.
First of all, let me thank our partners, the Health Action International, who have been partnering with us in handling the issues of snakebite prevention in Shiru Ward in conjunction with the Department of Public Health, the NTD department. I think from their inception, we have been able to do sensitization in the community. First of all, we sensitized our CHPs, and then after we rolled the project to schools, we have been able to sensitize schools, and we have been able, through the sensitization, to sensitize our communities on how to prevent snakebite prevention. Before we had this project, most of the snakebite cases in our communities were not recorded because most of them have been handled within the communities. And now, going forward, we have been able to capture most of the cases within our communities. Through our CHPs, they have been able to report on time. And through that, we have been able to develop a reporting tool for the department. And also, so far as Shiru Ward, we have a Google form whereby our CHPs report on time the cases of snakebite. I think from those initiatives, we have been able to change the reporting and also capture that data, which will enable us to make that informed decision going forward.
The snakebite sessions in Lugari are well picking up. In fact, all the facilities in Lugari level 4, we already have the antivenom vaccines. I want to appreciate the program because Lugari is interior. It has many forests. Before we interacted with the program, I had 30 cases of snakebite for the last financial year, July 2024 to around May 2025. Those cases, we were not able to detect them early. By the time we met with the program, the 100 students, learners were trained. And I'm happy to report that it's better to train learners because they took what they were being trained to their homes. So far, the impact is good. I'm having a reduction in snake bites. Those who are going to the forest very early in the morning, our learners told them to at least start going to the forest at around 9. So reduction in forest activities. I'm also happy to report that since then, our Ministry of Health, we are able to now to procure the antivenom vaccines. And as at now, the 3 level 4 hospitals, that's Matete Sub-County Hospital, Lumakanda County Hospital, and Mautuma, we already have the antivenom vaccines.
The biggest challenge we faced is availability of the anti-snake venom. We've had challenges regarding stockouts, particularly going with the average monthly consumption patterns and ensuring you have those commodities within the minimum and the maximum so that whenever there is need, then our patients are able to get that commodity. So I think for me, largely it's been the stockouts. It's what we have tried to face over the years, coming up with policies, structures to ensure that we have a seamless, uninterrupted supply of these commodities that is responsive, not just in our referral hospital, but especially so now that we have 12 sub-counties, 16 hospitals, ensuring that all these hospitals, then they have this commodity.
We've had partners come in and support us on prevention and control in snakebite envenoming through various interventions. And the partner we are talking about is Health Action International, who came in handy to sensitize various stakeholders on snakebite management, prevention, and control. And when we talk about the stakeholders, we had data that informed us and informed the partners to come in for these various intervention. And the data was that we had snakebite cases in the previous years, that is 2022 and 2023. And the snakebite cases we had were in
Central Maragoli ward and Wamluma Lugaga ward, and scanty cases around Mungoma and South Maragoli ward because of the terrain and the geographical nature of the area, that is areas around Maragoli Hills. So we had cases almost five ranging 5 to 10 in the 2023, but currently we've not had any case. These stakeholders were trained differently. We had our community health promoters who came from various, they pointed out areas where we had cases. They were trained basically on management, that is the first aid, the prevention and control bit, but because that is where they have specialized during their visits in the household or at community level. So we had over 20 CHVs who were trained on that, and they're reporting monthly on those cases.
But so far, we want to thank Access to Medicine for introducing the project of snakebite prevention in our communities. So far, we are able to sensitize most of our community members through the use of the CHPs, our ward PHOs, and some of our teachers. So we're also able to sensitize our schools, that is Musunji Primary and Jidereri. We believe students are good change agents. At the same time, they also are good media to pass information. So we have all reached some of the schools, even though we are planning to reach others later. So the project has brought some impact because at the moment we're able to see people reporting the cases, even though some not reached the facility, but at least in the community we're able to be told that we've had a case of such, and the patient had been referred to Kapsabet or Kaimosi or even VCRH services.
This commitment was a direct result of the project's advocacy, proving that data-driven action leads to sustainable change.
We had sub-counties reporting high numbers of snake bites, and we just wanted to find out if they had any opening that they could start up. We had an inception meeting for this new program with the Access to Medicine platform, and the first thing was just to map out our sub-counties and look at which is the most affected sub-counties. And you know, in Kakamega, we have the forest area, that is Malava sub-county. We have areas that are, we have a lot of trees. So we looked at that and said we could just start with a few sub-counties looking at our population. Malava having a high population. We looked at Ikolomani, Matungu, Likuyani, that is the northern area. So then we thought the main challenge is even the health workers, when the patients visited the hospitals, they were not able to manage this appropriately because they did not have the skill. So the first thing is even as we bring in this new program, we needed to sensitize the community, we needed to sensitize the health workers. We had a training for health workers in Kakamega County so that they can know how to effectively respond to snake bites. After this training, we had to look at the main challenges which arose from the training, because the healthcare providers now had part of the recommendation or the challenges. They said even if they have received the training, they did not have the antivenom in their facilities. And we asked them, the issues were arising from the cost of the antivenom and even how to use the antivenom. So as the Chief Officer, Public Health, I quickly had a meeting with my colleague, Chief Officer, Dr. Lila, who is the Chief Officer, Medical Services, just to see what is the most sustainable way of supporting facilities to have antivenom available at all times. And it is good to report that in that discussion, then the Chief Officer Medical Services, having had an internal policy that 30% of their FIF collection is reserved for pharmaceuticals and non-pharmaceuticals. And as we are aware, antivenom is one of the drugs which fall under that category. To also have a sustainability model in this project, to prioritize antivenom among what they are procuring in terms of public health commodities. And that is part, because we procure other commodities that we use. So that is what we actually did. And therefore, we have consistently had antivenom in our facilities.
If you look at the data that we have on KHIS from January to December 2024, we had up to 163 cases reported at our health facilities. This year, from January to August, we've had up 75 cases of snake bites reported in our health facilities. But this is just part or portion of the total cases of snake bites that are experienced within the county, because we have those ones that are happening in the community, but they are not reaching health facilities. The community is trying to manage them within the community. So those are the ones we have on KHIS, but they are more than that, because if you compare with the data from our CHPs of those ones that happened in the communities, they are more than that.
Like 2021, generally we had total was 560 cases, but the highest sub-county that reported was Nabaholo with 90 cases. So this is what we call the Kenya Health Indicator in a KHIS survey. We usually do the deworming, mass drug administration, and during also the mass drug administration, we usually collect the snake bite cases.
This snakebite project has been an eye-opener across the county. Actually, you talk to healthcare workers, they'll tell you very well that it is true snake bites are there, but many of them were not sensitized on what they are supposed to do. But right away now, there is a very big difference on what used to happen before the project and after the project. There is a very big difference which can be measured, and I think some data can also explain to that difference. With the personal level, at personal level, for sure, and to be very, very, very sincere, we used to receive snake bites. We were part and parcel of the people, however skilled, but we were also perpetuating a lot of myths about snake bite management. Skills to manage a snake bite patient, right from emergency, right from up to the follow-up of these patients, even up to reporting, that we're now an expert there. Not only that, I'm now a trainer who is imparting skills to the rest of the staffs. Let me pick an example of now the experience I have with my staffs. Because of my personal experience, I'm able to OJT those whom we work with. I'm able to manage a patient of a snake bite.
Before the Health Action International or the Access to Medicines came to the county, ideally we did not really give much value to snakebite and envenoming as compared to other neglected tropical diseases. We were very much engraved into other issues like the STHs and other entities. But now when Health Action International came to the county, it opened our eyes as a county and also at the sub-county level that we have got a very serious neglected tropical disease that we were also to put much focus onto it. So I would say that the coming of Health Action International was an awakening or gave us an eye-opening to snakebite and envenoming, and also shed some light on how best we can really put measures and strategies to also ensure that snakebite and venoming is put to light, people are aware, and so that we can also limit the number of cases that we usually experience as a sub-county. Bearing in mind that Shinyalu sub-county is within the confines of a very large forest that is known as Kakamega forest.
Even with antivenom, if you don't tell the public that it's available, then the use may not be important. So we, in all our public forums, we have put it as a priority to sensitize the community that in case of any snake bite, we give them the preventive materials first. Then we also inform them that antivenom is available in our facilities.
This government has come in strongly to ensure, one, primary health care is one of the things given the emphasis that it deserves. And then two, how do we build in quality health? How do you ensure that Mwananchi gets the best quality, which is a misnomer? Quality healthcare services. I mean, once it's quality, it's best.
Staying safe from snakes is about being alert and making small changes to your daily routine. Always wear closed-toe shoes when walking in bushy areas or in the dark, and carry a light at night. As you walk, tap the ground ahead with a stick to warn snakes you're coming. Around your home, keep your compound clean. Slash tall grass and store firewood away from the house. Finally, seal any holes to keep out rats and frogs, as their presence can attract snakes looking for a meal. If a snake bite occurs, remember these steps. First, help the person stay calm and still. Gently move them to a safer location, away from the snake. Quickly remove any tight clothing or jewelry near the bite before swelling begins. Wash the wound gently with running water and cover it loosely with a clean cloth. But here is the most critical step. Get them to the nearest health facility without delay. Antivenom is the only cure, and speed is essential. Do not hesitate. Rapid transport saves lives.
There were firewood beside our kitchen, so I told my mother to put them away. Then she did it. Then again, I told my father to put for us a net in our house. We never use nets at home, so we use the nets again to prevent the snake from entering our bed. We also used, tulifyeka pia nyasi kwa nyumba tukatoa. Tulijua tu venye ulitufunza nyasi, nyoka wangekuja kwa nyasi then waingie kwa nyumba. Tukafyeka, sahi nyumbani kwetu kuko neat.
I've been able to tell my parents that it is not okay to use herbs, because herbs can make the part that has been bitten paralyzed.
Tumeshukuru sana kwa hii Health Action International ya kwamba imeweza kutufunza na sisi tukafunza vijijini, tukafunza group members, tukafunza hata wakati tumekuwa kwa shule, nilifunza watoto juu ya snake bite, jinsi ya kujilinda na jinsi unaweza tembea na jinsi nyoka. Tuliambiwa ya kwamba nyoka si adui. Nyoka ni mnyama tu kama sisi, ya kwamba unapoona unaweza kumwacha tu anapita, because kama hutakanyaga nyoka, nyoka haiwezi kuuma. Nimeweza kuadvocate hata kwa kanisa yangu hii Church of God, nimewaambia juu ya kujilinda na nyoka. Hata kwa wenye naishi nao hapa nimewafunza, sio lazima wakipata nyoka wafatane naye waue, ni kuacha tu, lakini udumishe usafi na uache nyoka ishi vile watu wengine wanaishi.
Ukiangalia mtu alikuwa ameacha kichaka, saa hizi amefyeka. Ukiangalia mtu nyumba ilikuwa iko na mashimo. Nikienda kwa hiyo nyumba naangalia napata haina mashimo.
The journey isn't over. The success in these counties is a blueprint, a model for the world. By raising our voices, we can ensure that snakebite is no longer a neglected disease and that every life, no matter where it's lived, is protected.
For snake bites, we are actually standing in the gap and advocating for the poorest of the poor, because we all know snake bites only occur in rural communities that live on less than $1 a day. And so faced with this burden, they are not even able to afford the cost of treatment. And speaking of treatment, we are also happy to note that within the new social health insurance fund, there has been some consideration in terms of co-financing of the antivenom, because currently it's being co-financed at 50% of the cost, which means the health insurance pays 50% of the cost of the antivenom. But most importantly, snake bites are classified as a critical and emergency disease, and therefore, in the instance where somebody is bitten and they do not have resources and are taken to the facility is now obligated to provide that treatment and, look into the issues of charging after that life has been saved. And for me, I would say this is really a big win for the work that we have done here in Kenya in terms of snake bites. So we have had limited funding that has allowed us to do this work. And so, of course, highlighting the outcomes and the impact of this project in Kenya is important so that we can mobilize more resources to not only scale this project, but to expand its scope, to expand the data availability, to expand availability of these commodities, to improve the treatment options, and to save lives, most importantly. Because we cannot eradicate snake bites. Snake bites are part of the ecosystem and they play a very vital role in this ecosystem. The best way is to learn how to prevent. And in the instances prevention is not possible, we know how to treat the snake bite incidences effectively.